Hello, my name is Sally Boyd. I'm a general surgery resident at the Virginia Commonwealth University Health System in Richmond, Virginia. Today I'm going to be giving our talk entitled The Risk Analysis Index. When is the patient too frail to undergo a carotid endarterectomy? We have no disclosures, and the contents of this presentation do not represent the views of the United States Department of Veteran Affairs nor the United States government. Frailty is one patient factor that's distinct from age and comorbidities that's garnering attention in the surgical literature. It can be measured in a variety of ways and has been associated with poor postoperative outcomes in many different specialties, including vascular surgery and specifically patients undergoing carotid endarterectomy. The Risk Analysis Index, or RAI, is one validated measure of frailty that's been used to predict postoperative outcomes in many different types of surgical patients. It's based on the patient's history and factors in things such as age, cancer status, nutritional status, and certain comorbidities. It can be easily applied with retrospective chart review or calculated preoperatively without the use of patient testing or special equipment. The RAI was initially developed by Hall and colleagues and subsequently recalibrated by Aria and colleagues. The variables included in their respective scores are shown here on the right. As you can see, some variables have different assigned scores based on whether or not the patient has cancer and then whether or not the patient has cognitive decline. The Veteran Affairs Surgical Quality Improvement Program, or VASQIP, is a national database that houses information about patients who undergo operations in the VA health system. It uses CPT codes and has information about 30-day outcomes, including morbidity, mortality, length of stay, readmission, and reoperation. The objective of our study is to evaluate the effect of frailty as measured by the RAI on postoperative outcomes following CEA. For our methods, we use the VASQIP database to look at patients who underwent CEA between the years 2002 and 2015. We included asymptomatic patients only. We used chi-square, ANOVA, and binary logistic regressions in our statistical analysis. Based on previous studies using the RAI, we classified patients as non-frail if their score was less than 30, frail if their score fell between 30 and 34, and very frail if their score was greater than or equal to 35. For our results, over 40,000 asymptomatic patients underwent CEA. Over 98% of them were male, and the average age was 68 years old. 83% of patients were considered non-frail, 12.2% were considered frail, and only 4.7% were considered very frail. Frailty, as calculated by the RAI, was associated with increased rates of postoperative stroke, complications, death, and a longer hospital length of stay. And looking at our binary logistic regressions using the non-frail group as the reference group, we again found that increasing frailty was associated with higher risk of postoperative stroke and complications, including both frail and very frail groups. Only the very frail group was associated with death significantly. The limitations of our study include that the patient population was largely male. We were only able to examine 30-day outcomes versus more long-term outcomes, and details about complications are limited when using a large database such as the VASQIP. In conclusion, increasing frailty as determined by the RAI was associated with worse postoperative outcomes in asymptomatic patients undergoing CEA. Higher RAI cohorts had higher rates of post-op stroke, death, and complications. This data is congruent with other studies that have shown frailty to be associated with poor postoperative outcomes in vascular surgery patients. This highlights the importance of preoperative screening, risk stratification, and appropriate patient counseling. The Risk Analysis Index may be a useful tool in these discussions. This is my contact information, and I would like to thank VES for the opportunity to present this project. Thank you.